Welcome to Building Courage to Have My Baby. Listening to this program will help you remain calm while you make the difficult decisions about your pregnancy, your baby, and your future. My name is Jim Lohr. My wife and I adopted an infant born of an unplanned pregnancy of a single woman. This little girl became the joy of our lives. I developed this program to help you be more comfortable in your pregnancy and to honor her birth mother. Recording this program for you on YouTube is my way of supporting you and your baby during your difficult time. This program will help you think through the challenges of an unplanned pregnancy. It teaches you how to relax your muscles, pair that relaxation with imagining some of the difficult decisions and experiences during your pregnancy, which will help you stay calm during those difficult times. When you are nervous or worried, it is normal for your muscles to tense up. Tense muscles automatically make you trash talk yourself with automatically anxious or negative thoughts, or you make your mind go blank entirely. Learning how to recognize and reduce the muscle tension will either help you stop the trash talk or help you be aware of how you feel physically and how reasonably you are thinking and talking. As we begin track 1, please try a little exercise with me. Because I am going to ask you to close your eyes, please do not drive a car or work with machinery while you are listening. Assuming you are not driving a car or operating machinery, sit comfortably in your chair and relax. Close your eyes and imagine you are watching a good movie. You have seen these movie stars before and you enjoy them. The music and the dialogue are well written. The scenes in the movie are believable. The plot is predictable. The end of the movie is a happy one. You hear yourself repeating the lines of the movie in the back of your mind because you enjoy hearing them again. You really like this movie and you feel very relaxed and calm. You tell yourself, what a good movie this was. Now turn off the movie in your mind just as you would turn off a television set. Open your eyes and come back to the here and now. Now close your eyes again and imagine you are stuck in traffic. It has been a long day and you are tired. Horns are honking and people are snarling in the cars around you. You start talking to yourself and your voice sounds harsh and unpleasant. You just want to shout out at another driver who cut you off, but you try to keep your temper in check. You just want to be away from the traffic and home relaxing. Now turn off that picture from your mind and come back to the here and now. Did you find a difference in the two scenes you imagined? Was the first one enjoyable and the second one unpleasant? If you could tell the difference of how you felt and what the thoughts were in the back of your mind, you begin to understand how your own muscle tension and anxiety can affect how you view situations. If you are anxious about your pregnancy, you are probably the victim of that same muscle tension and negative thoughts that were part of the second scene. This program will help you if you are calm most of the time, but nervous when you have to make decisions about your pregnancy. Being nervous usually means that somewhere in your body, some muscles are tense. Tense muscles automatically translate into your mind as nervous thoughts like, I just can't decide now. This is absolutely overwhelming. What should I do now? Will anyone listen to my needs? This program uses a good way to help you change how you feel and think based on a method called conditioning or systematic desensitization. In it, I explain how to tense and relax your muscles, which helps you quiet your anxious thoughts. Then I have you imagine several points coming up in your pregnancy where you probably will be tense like you were when you were caught in traffic. I will ask you to keep your muscles relaxed and imagine those same points until your mind stays quiet and you can think clearly in that situation. This program does not involve any hypnosis or any subliminal voices. On the next track, I will describe how to relax your muscles deeply and how to imagine scenes in your mind. tracks 3 to 12 apply that relaxation and imagining exercises to 10 decisions you will need to make during your pregnancy. Please listen to the relaxation exercises on track 2 until you can relax fully and your mind is calm and quiet. Then begin to listen to tracks 3 to 12, where I will have you relax and imagine yourself in the scenes during your pregnancy. When you listen to each track starting with track 3, please listen to the track enough times that you can keep your muscles relaxed and your mind calm before you move on to the next track. Replay track 3 until your mind will stop accusing you or being angry and you can think calmly about your situation. If you listen to a track at least 5 times, you should be able to identify how you would tense up in a real situation. If you become tense in the real situation, then you will be aware of your anxious thoughts. If you listen to the track 10 times, you should be able to keep your muscles relaxed and you may not have those automatic anxious thoughts at all. You should be able to handle the situation more calmly and more reasonably. As I said before, combining deep muscle relaxation and imagining exercises is called systematic desensitization. If you relax your muscles and gently work through a series of scenes that you will be nervous about, you will be better able to control that nervousness when you face those situations for real. Relaxing and rehearsing what you will do several times will help you plan calmly when the situation actually occurs. From my other projects with relaxation, I have helped students control their own fears while taking tests, giving speeches, and have patients undergo cancer treatment with less pain and discomfort. There are 2 ways to do the muscle relaxation. For training purposes, I will begin with the long way of relaxing each muscle. Later on, or in situations where others are with you, you will be able to use a short way I will show you toward the end of the training track. Do not do any exercise to the point of pain. Skip exercises in particularly tender areas. At first you may feel that these exercises seem silly, but soon you will begin to feel the many benefits these exercises have to offer. Now move on to the second track of the program, the training exercises for tensing and relaxing your muscles and for visualization. The training exercises for your muscles was originally developed by 2 psychologists, Dr. Joseph Walpe and Dr. Arnold Lazarus, for their book Behavior Therapy Techniques, published by Pergamon Press in 1966. I appreciate Dr. Lazarus' permission to let me share the exercises with you in this program. Track 2, Relaxation and Visualization Training. Sit comfortably in a chair as we begin the training. We suggest a straight, firm chair without too much padding or a dining room chair with a back that is not too high. As we begin the training, sit comfortably straight with your feet on the floor and let your arms and hands rest comfortably on your lap. Now, as you sit in your chair, lift your legs up from the floor and point your toes away from your body to the point you are stretching and tensing the muscles in the fronts of your legs. Hold the tension for about 4 seconds or to a count of 4, and then relax them. 1, 2, 3, 4. Now let them drop back onto the floor. Lift your legs again, and this time point your toes back to your face and hold the tension through the count of 4. 1, 2, 3, 4. Now relax your legs. Now tense your thighs and upper legs by pushing your heels into the floor. Hold the tension to a count of 4. 1, 2, 3, 4. Now relax your legs. Push your hips into the chair seat and hold them to the count of 4. 1, 2, 3, 4. Now relax your hips. Tighten your stomach and abdomen until they are hard. The old military phrase, suck in your stomach, applies here. Hold the tension for about 4 seconds. 1, 2, 3, 4. Now relax your stomach. To tense and relax your chest, take a deep breath and hold it a bit longer than is comfortable, and then relax it. For some people, this may be a count of 7. For others, fewer may be enough. 1, 2, 3, 4, 5, 6, 7. The next exercises involve your back. Now, if you have any problems or injuries to your back, please do these exercises very gently or skip them entirely. Bring your shoulders up and move them around in a circular pattern. This should tense the muscles in your back. If you can, move your shoulders in a circular motion, up to down, and then reverse the direction. Now arch your back as though it were a fish hook. Hold the tension for about 4 seconds. 1, 2, 3, 4. Now relax your back. Let it return to its normal position. Tense your upper arms by placing your fingertips on your shoulders and flexing your biceps. Hold the tension for about 4 seconds. 1, 2, 3, 4. Then relax your arms. Let them come back comfortably to your sides. Now hold your arms out straight from your shoulders to the front. Keep your elbows tight so that you feel the strain in the triceps muscles in the backs of your arms. Hold them to a count of 4. 1, 2, 3, 4. Now let your arms relax. Now clench your fists tightly so that both your hands and your wrists are both tight and tense. Hold the tension for about 4 seconds. 1, 2, 3, 4. Now relax your hands and your fists and your wrists. The next exercises involve the muscles around your eyes. If you wear contact lenses or other protective devices, or you've had cataract surgery or other eye surgery recently, do these exercises very gently or not at all. First, tense the muscles of your scalp and forehead by wrinkling it up. Hold the tension. 1, 2, 3, 4. Now let the muscles relax. Now push the muscles of your forehead down. Wrinkle them down into a frown. Hold the tension. 1, 2, 3, 4. Now close your eyes very tightly and hold the tension. 1, 2, 3, 4. Now relax your eyes. By the way, if you have trouble getting to sleep at night because scenes of the day keep flashing before your eyes, using these specific tensing and relaxation exercises around the eyes will reduce the flashing. Re-seeing the scenes of the day is caused by tense muscles in the eyes shooting. Relaxing the muscles will help you reduce the shooting experience and let you get to sleep. Now, unless you wear dentures, partial plates, or braces, clench your jaws tightly. This should tense the muscles in both sides of your jaws. Hold the tension for about 4 seconds. 1, 2, 3, 4. Now relax your jaws. Unless you have a cleft palate or dentures, flatten your tongue and push it against the roof of your mouth. Hold the tension as you move your tongue around the roof of your mouth. 1, 2, 3, 4. Now relax your tongue. Press your lips together tightly. If you're a girl or woman, you have probably blotted lipstick this way. Boys or men, you've seen your mother or wife or girlfriend do this. Hold the tension. 1, 2, 3, 4. Now relax your lips. Tense your throat and neck by pushing your chin against your chest. Hold the tension for about 4 seconds. 1, 2, 3, 4. Now relax your throat and chin. Again, by the way, if you're trying to get to sleep and you keep rethinking the conversations of the day so that you can't turn them off, tensing and relaxing the throat and vocal cords this way will also let you get to sleep more quickly. Now open your mouth and give yourself a deep yawn. Hold the yawn for about 4 seconds. 1, 2, 3, 4. Enjoy the yawn because this is very relaxing for your throat muscles. We have now exercised all of the major muscle groups of the body. You should feel very loose and saggy-baggy. Your mind should feel calm. Just take a few seconds and enjoy the feeling. Once in a very great while, if you're very relaxed, you may have some very bad memories come from the past. That is because muscles may shoot tense memories from the past. If this happens to you, and it is very seldom, you should see a professional counselor. I've now trained you in the long way to do the exercises. This may be the most complete feeling of physical relaxation you have ever experienced. Physical relaxation helps you become calm and clear-headed in general. I personally believe that the muscles themselves have a memory system of their own. Memories are stored in our muscles from times when we were very excited or very frightened or active physically or hurt physically. Most of us can remember a time when we were in physical danger or injured. If that same muscle group is pinched or squeezed, the memories of the original time will flood back to us. Tensing and relaxing the muscles may ease the tension and may ease those memories as well. Please practice the muscle relaxation exercises 2 times a day. You may become aware of other times when a muscle group has become tense. You may be in public at the time. You may not have a comfortable way to do the exercises this long way. Let me describe 2 other ways. The short way to relax the muscles is a thought process that you can use to relax individual muscles individually, easily, and quickly. If you become aware of a single muscle becoming tense, you can slowly say to yourself in the back of your mind the name of the muscle and tell it to relax. If you concentrate on it fully, the muscle will begin to relax. For example, you become aware that your shoulders are tense. Think to yourself, shoulders relax, shoulders relax, shoulders relax, shoulders relax, shoulders relax. Your shoulders will begin to relax. You will feel them loosen up. A short way to relax all of your muscles is to imagine your body as a large funnel you can see through, and your tension is a large amount of liquid in the funnel with a dark color. Start with the top of your head and see the tension liquid draining down through your head, through your neck and shoulders and back, and out through your arms and hands. See it draining down from your chest, through your stomach, and out through your legs and feet. These relaxation methods may seem strange to you, but they will help you become very relaxed and calm when you have practiced them. I will now describe the imagining exercises we will use in the program. Let's begin by very simple imagining exercises. Close your eyes gently to close out as much external stimuli as possible. Now make a picture in your mind of an orange. If you hate oranges or are allergic to them, imagine an apple. But assuming oranges are okay, see yourself holding the orange. Imagine its roundness, the dimples on the peel of the orange. Imagine you can feel its weight in the palm of your hand. If you can, smell the orange. Now turn off the picture just as you would turn off a television set. Open up your eyes. Could you see the orange? Could you smell it? Could you feel its weight in the palm of your hand? Some people can do this on the first try. Others take longer, but don't let that stop you. Let's go on to the next imagining exercises. This time I'd like you to imagine you're with a friend and you're having a good conversation. Perhaps you're at your favorite restaurant or meeting place or just in one of your homes. Now close your eyes and picture the room that you would be in. See the walls and the floor, the table, anything that might be on the table, cups or glasses or plates. Now see your friend's face, arms, hands, chest. Is this a friendly, happy conversation or a more serious one? Is your friend's face smiling and happy or tense? Listen to your friend's voice. Is your friend's voice excited or calm or sad? What is your friend saying? Are the comments pleasant and positive? Are they anxious and worried? Now be aware of yourself in that scene. Sort of see yourself from the inside. Remember the muscle relaxation exercises we just did? Are your muscles tense or relaxed as you see yourself in that scene? Are the muscles of your face and head tense or relaxed? The muscles of your neck and shoulders and back tense or relaxed? The muscles in your arms and hands tense or relaxed? The muscles in your chest and stomach tense or relaxed? The muscles in your legs and feet tense or relaxed? Now listen to the sound of your own voice from the inside. The sound of a person's voice is a very good indicator of tension. Is the sound of your voice relaxed and calm? Or is it tense or anxious? Now be aware of what you're saying to yourself in the back of your mind. Is it pleasant and enthusiastic? Or sad? Or tense? Or nervous? Are tense muscles shooting negative thoughts into your mind? That is the effect of muscle tension. It automatically shoots negative and anxious messages into your mind that block you from thinking clearly and doing what you need to do. Again, turn off the scene just as you would turn off a television set and come back to the here and now. Can you imagine the things we talked about? Could you tell whether your muscles were tense or relaxed? Could you tell how any tension affected your own voice and your own thoughts? Even if you can't do it at this time, you will be able to do so once you have practiced the muscle relaxation exercises several times. On the rest of the tracks on this compact disc, I will be combining these relaxation and imagination exercises with you visualizing yourself in 10 scenes. Before you begin listening to each visualization, please check to be sure that all the muscles are relaxed so that you begin calmly. Then I will ask you to imagine yourself in a situation. If you become aware your muscles are becoming tense as you listen to the track, please stop the CD immediately. Go back through as many relaxation exercises as you need to become fully relaxed again. Then restart the CD on the same track to start over and imagine that same situation again. Do not skip and go on to the next track until you can imagine that scene in your mind and remain calm and relaxed. You may need to repeat a track several times to revisualize a scene several times before you can move on. Please be patient enough with yourself to do that. Some of the scenes you imagine may not cause you any tension at all. Then you can go on to the next scene on the next track. Finally, because of your experiences between the times you use these exercises, different scenes may bother you at different times. This is perfectly normal. Still, do not just remain tense while visualizing a scene. Go back and do the relaxation. Please practice using the relaxation exercises twice a day besides the visualizations that you will be doing on the 10 tracks which follow. That will make the desensitization process much easier. This is the end of the second track. You can now go on to the tracks with the relaxation, visualization, and the 10 specific scenes. Now we begin track 3 of this program. Tracks 3 through 12 combine the relaxation exercises you just learned with 10 scenes leading to and through decisions about your pregnancy, your baby, and your future. Before we begin, make sure all of your muscles are relaxed. Being able to relax and stay relaxed will really help you make good decisions for yourself and your baby. Use the long way of tensing and relaxing each of the muscles individually, or the short way of seeing tension drain down through your body like liquid out the bottom of a funnel. If you need to, stop the program until you're ready and completely relaxed. Then continue to relax for a few more seconds before you begin. Now imagine a scene where you think you may be pregnant. Close your eyes and make a picture in your mind. Be aware of what room you might be in, the colors of the room, any furniture. Be aware of how you might look and feel in that situation, how your muscles might feel, whether they are tense or relaxed in that situation. Are the muscles of your face and head tense or relaxed? Your neck and shoulders and back, your arms and hands, your chest and stomach, your legs and feet. Now be aware of what you might be saying to yourself in the back of your mind about a possible pregnancy. Is the voice in the back of your mind calm and reasonable? You should get an accurate pregnancy test, because then you will know for sure if you are pregnant. That will help you clarify the situation more quickly than anything else you can do. If you can, talk with your parents or close friends about what pregnancy service you choose, because some pregnancy centers will care about your needs and your baby's needs, but other pregnancy services will immediately schedule an abortion, whether or not that is what you choose for yourself and your baby. Caring family and friends will help you with the test and talk about the results with you. Now turn off the scene and return to relaxing. Check to make sure that all of your muscles are relaxed. Check the muscles in your face and head, your neck and back and shoulders, your arms and hands, your chest and stomach, your legs and feet. Be sure you are completely relaxed. If you could not stay relaxed during the first scene, then relax completely and then replay the entire track again. Replay the scene as many times as you need to until you can stay relaxed during your visualization. Do not go on to the next scene until you can stay relaxed during this one. The same will be true for each scene in this program. If you cannot stay relaxed while you visualize, go back and replay the track again, just as you would replay one of your favorite songs, until you can visualize and stay completely relaxed. Be sure you are completely relaxed before you move on to the next track. The fourth track will apply if the test shows you're pregnant. Even a wanted and planned pregnancy is a major adjustment in a woman's life. Finding you are pregnant when you had not expected it is more difficult and more scary. Your first impulse is likely to be tears and panic. What do you do now? How do you tell people? How can you afford it? What can you do what's best for you and for your baby? The pregnancy center staff should be there to help and support you. Their staff should listen, comfort, help you find strength and plan for the resources you will need for yourself and your baby. So make this scene in your mind. Be aware of the room around you, the furniture, the pregnancy staff member who would be there with you. Be aware of yourself and how you feel. Be aware of the thoughts racing through your mind. Now trace those thoughts to where the tension is in your body and relax those muscles. Is there tension in your face and head, your neck and shoulders and back, your arms and hands, your chest and stomach, your legs and feet? Replay this track as often as necessary to keep your muscle groups relaxed. And be aware that your thoughts are slowing down in the back of your mind and that you are becoming more calm. Again, replay this track until your thoughts are calm and reasonable. In your imagination, keep listening to the support and the help that is offered you by the staff or family or friend who came with you. They will be there with you in this very difficult situation and can help you make the situation more manageable. Now, when you can stay relaxed and think calmly, turn off this visualization and relax before the next scene. If you have waited to tell your parents because it will be difficult to do so, let's move on to track 5, I tell my parents. Imagine the room you would be in. See the couch you might be sitting on. Other tables and chairs in the room. How would your muscles feel during this? If you are hearing nervous thoughts in the back of your mind, check your muscles to see which ones are tense. Are your face and head muscles tense? Your neck and shoulders and back? Your arms and hands? Your chest and stomach? Your legs and feet? Can you tense and relax your muscles? If necessary, turn off the program and tense and relax your muscles. Now be sure you are thinking clearly about how you will tell your parents. Yes, they may be hurt and angry, but if they love you, they will get over it. You are their flesh and blood. They will not throw you out. What will help the most is if you can take responsibility for your own actions and speak clearly with them about the changes your pregnancy will mean for all of you. Now turn off the visualization and return to relaxing. But replay this track and visualize the scene again if you couldn't handle it without becoming tense. I want you to visualize it until you are no longer becoming tense while you are thinking about it. Be sure all of your muscles are relaxed. If you are still making any anxious statements to yourself, there are still some tense muscles somewhere. Imagine yourself as a funnel filled with liquid tension. See the tension drain down from the top of your head, down through your neck and back and shoulders, out through your arms and hands. See the tension in you drain down from your chest and stomach, down through your legs, and out through your feet. And now relax. Do you know who the father of the baby is? The 6th track is a visualization where you tell the baby's father you are pregnant. Even if you cooperated willingly in conceiving the child, it is just as important for the father of the child to take responsibility for his child, too. His first response may be to ask you whether it is his child. If you can stay relaxed, think clearly, and answer firmly, you will deal more easily with the charge that you have been unfaithful to him. He may also be very likely to ask you or tell you to get an abortion. An abortion will be the easiest and cheapest way out for him. Otherwise, he will be responsible to help pay expenses for you and to support the child until the child is 18. If the father is underage, his parents may also be held responsible. If you are underage, the father of the child may face criminal charges. So it is essential that you have calmly thought about and even rehearsed your responses to him. You need to protect yourself and the child from a hasty abortion. Now is the time to prepare for this discussion by tensing and relaxing your muscle groups, either individually or by seeing tension drain down through your body. You may even want to think out or write out some possible responses to the things you think he might say. Your situation will be even more difficult if you are raped, date raped, or do not know who the father of the child is. However you can, reach out to your parents, supportive friends, and legal authorities. But you need to remain relaxed to make clear decisions. Be aware of your muscles and whether your face and head are relaxed, your neck and shoulders and back, your arms and hands, your chest and stomach, your legs and feet. If you are having panicked or negative thoughts, then there are probably still some tense muscles in your body. Be aware of where the tension is, and then repeat the cycles of relaxation and visualization until you can maintain the visualization without becoming tense during it. Now turn off the visualization, return to relaxing. Check your muscles to be sure they're all relaxed. Are your face and head tense or relaxed? Are your necks and shoulders and back tense or relaxed? Are your arms and hands tense or relaxed? Are your chest and stomach tense or relaxed? Are your legs and feet tense or relaxed? Be sure your muscles are all relaxed and rest a bit before beginning the next visualization. Track 7 is where you imagine you are telling your friends, other family members, and others in your community who need to know about your pregnancy. Hopefully, by this time, your immediate family knows. Often a sister may be the first person you have told. If your parents are significantly older or are judgmental for religious reasons, your other brothers and sisters may need to be told first. Your real friends will stick with you and will be friends for life because they did. Once your parents know, ask them to tell your grandparents and other family members and other adults of their generation. You should be with them at the time. It will be very important to stay calm and clear in your thinking and talking. Make a picture in your mind of those scenes. See the rooms where you would be. Be aware of how your muscles would feel in those scenes. Your face and head, neck and shoulders and back, arms and hands, chest and stomach, legs and feet. Now be aware of what you are saying to yourself in the back of your mind. Now turn off the visualization and return to relaxing. Check your muscles groups for any tension that may have crept in. Is there any tension in your face and head, your neck and shoulders and back, your arms and hands, your chest and stomach, your legs and feet? Relax any muscles you find that are tense. You may need to relax and revisualize this scene several times before your mind stays calm, and if it does, take the time to do so. Then just relax for a few seconds. In Track 8, you consider an abortion. Even if no one else knows, you will always know that you conceived a child and did not give it a birthday. Even if you don't tell anyone, the decision will stay with you forever. Will relieving the short-term pain of your pregnancy by terminating it be worth the forever pain that you will continue to carry? Sometimes women have long-term health problems after an abortion. Often women have significant depression, sometimes years later, when they realize the harmless procedure wasn't as harmless as they had thought. But the decision has to be yours. Keeping your muscles relaxed and your mind clear will help you make your decision. How do your muscles feel as you consider this decision? The muscles of your face and head, the muscles of your neck and shoulders and back, the muscles of your arms and hands, the muscles of your chest and stomach, the muscles of your legs and feet. Now, what are you saying to yourself in the back of your mind about how your baby looks inside of you now? Now turn off the visualization and return to relaxing. Relax all 5 of the muscle groups again and be sure you are thinking clearly before you begin again. If you were not able to stay relaxed during the visualization, please go back and replay this track as many times as you need to remain relaxed while you visualize. In Track 9, you consider keeping the baby and raising it yourself. Congratulations! Your baby will have a birthday and you will be there to share it. Many friends will support you in the process. If you need financial help, there are social service agencies which can help provide support. You will need extra support from your family and friends to provide child care, keep a job, and provide you with emotional support, but it can be done. Make that scene in your mind. Be aware of how your muscles would feel and what you would be saying to yourself in the back of your mind. Replace any anxious statements with calm and reassuring thoughts of how you will be able to survive and support your child. If your mind is calm, planning for both of your futures will be much easier. Now turn off the scene and return to relaxing. Check your muscle groups and be sure no tension has crept in. Is there any tension in your face and head, neck and shoulders and back, arms and hands, chest and stomach, legs and feet? Relax any muscle groups that may have become tense during the visualization. Be sure the things you are saying to yourself in the back of your mind are calm and reassuring. In track 10, you consider adoption. If your baby is adopted, your baby will have a birthday and two parents to share the birthday with. If you reach out to a formal adoption agency, social workers will carefully screen possible parents for your child to be sure that they will be good parents. Sometimes adoptions can be arranged with the help of your physician or members of your faith congregation. Your child will be placed in a loving home among one of the hundreds of couples who have not been able to conceive a child themselves and are waiting for your gift to them. See yourself in that scene. See the room, the chair, the people in the room. Imagine the faces of the adoptive parents when they first see your child. Even if you don't meet them, they will honor your courage for having your child. I know because I'm an adoptive parent. You can imagine the joy in their eyes and hear it in their voices. Now be aware of how you feel. How tense or relaxed are your muscles? Your face and head, your neck and shoulders and back, your arms and hands, your chest and stomach, your legs and feet. What are you saying to yourself in the back of your mind? If you can focus your thoughts on the joy you will bring to the adoptive parents, it may help you to calm your muscles and calm your mind. Now turn off the visualization and return to relaxing. In track 11, you don't feel you have the financial means to complete the pregnancy. Actually, this is more of a fear than a reality for most mothers. Members of the medical profession can often help you connect with social service agencies, who in turn can help you connect with adoption centers or members of your faith community who will help you. Now continue the visualization and check to see how your muscles would feel in that situation. Your face and head, your neck and shoulders and back, your arms and hands, your chest and stomach, your legs and feet. And what messages are you giving yourself in the back of your mind? If they are calm and help you focus on the task at hand, then you have been able to remain relaxed. If they are messages of anxiety and panic, there's probably some unresolved muscle tension somewhere in your body. Then turn off the program and relax your muscles completely. Replay this track of the program until you can maintain the relaxation, your mind is calm, and you're able to plan clearly. In track 12, the final scene you will visualize, imagine if you need help to finish high school or college or stay in your present job, if that is a concern for you. Hear yourself giving yourself the calming advice, I can do it. Family members who love you and true friends will encourage you. You have had a life-changing experience. Your new awareness and maturity may actually make things easier for you. So see the room that you would be in. Be aware of the furniture. Be aware of any other people in the room. Now imagine how your muscles would feel in that situation. Your face and head, your neck and shoulders and back, your arms and hands, your chest and stomach, your legs and feet. Now what is going through the back of your mind as you would be in that situation? Are your thoughts about the future calm and clear? Check your muscles to make sure that none are tense. If you have any particular muscle or muscle group that you feel is becoming tense and you are anxious, then name that muscle and slowly and gently repeat to yourself several times the name of the muscle and tell the muscle, muscle relax, muscle relax, muscle relax, muscle relax. You will feel the muscle or group of muscles begin to relax. Be sure you are completely relaxed as you close this visualization. Since you have now learned what muscle tension feels like and how differently relaxed muscles feel and how tense muscles can influence your thoughts, you may become aware of tensing up and becoming anxious in other situations as well. If you do, you can use the long way of relaxing each of your muscles or the short way of seeing the muscle tension drain down through your body and out through your feet. Then you can review your thoughts going back through the back of your mind to check for any anxious thoughts. Once your muscles are relaxed, you will be able to imagine calming thoughts for that situation as well. If you find other situations which bother you, you can check my website, buildingconfidencecds.com, for several additional programs in my Building Confidence CDs series. There are audio-only MP3 versions of those same CD programs that can be purchased through Amazon.com, but if you decide to buy a download from Amazon.com, please choose a full album download version so you can hear the program's tracks arranged in their most effective order. If you do not find a program that fits your specific need, please contact me and we will discuss a possible adaptation. Just as no one religion fits everyone and no one drug helps everyone, this program may not have worked for you. But if you listen conscientiously several times, this program is likely to provide you with great relief during your pregnancy. As I said at the beginning, my wife and I are adoptive parents. We greatly appreciate the courage of our daughter's birth mother. Our adopted daughter was married in 2011. With her permission, we invited her birth mother to sit with us during the wedding. In part, this program honors her birth mother's courage. I hope this program will also help strengthen your courage during your pregnancy. I hope that you will give your child a birthday and a full and happy life. Thank you for your courage in listening. Jim Lohr.